Thank you, Peter. What we're going to cover today is a first rib fixation syndrome. I see this a lot in my practice where the first rib becomes locked down and it loses its motion, typically in a superior fashion, and it leads to a lot of spasm in the trapezius muscle, pain into the shoulder. It mimics some impingement syndrome, but it will also interfere with the scalenes here to give you tingling, numbness, peripheral neuropathy, and a condition that contributes to carpal tunnel. So I will always look for this if people have some trap issues that do not resolve from manual therapy or adjustments to the thoracic spine and the cervical spine. And the first rib, you'll actually find that right out in between that notch, right here, supraclavicular notch, and it'll typically be tender with a lot of spasm, and the scalenes will be very sensitive as well. And a client will tell you a difference from one side to the other. Typically when you hit it, they'll have a pull away, a jump response, and that typically means that you're on the right spot. So there's many different ways to do this one. You can do it from a seated position, supine. I like to do mine in a prone position, and I'll actually show you how I release that first rib. It's a high speed, high velocity manual therapy adjustment. Okay, so if you get you face down here. Now I typically like to put a little bit of a tilt in the headpiece so you can lift your head up, and then down. Okay, just put them into a little bit of flexion, which relaxes this. And I like to stand on the opposite side of the first rib. I'll get a scissor stance here. I'll come at a superior inferior angle, a little bit of lateral, and I'm going to hook in right here on the top of my hand and here. And I'll take the head and I'll put it into a little bit of lateral flexion and rotation, get it right to that joint angle. And you can see I'll come over with my elbow, and when I do it, it's a simultaneous boom. Real quick, it just drops down to the line of drive. You'll feel it manually release right around that first rib. And you will typically feel, or a patient will tell you, they feel an immediate improvement in symptoms and the things that they presented with, and the trapezius swelling will immediately go down. Typically, you only have to do that adjustment maybe 1 or 2 times to resolve the condition.